Hypertension medication. Yeah, I don't know what the doctor's talking about. I'm good. I don't think I need this. I'm good. I'm good. I'm good. Come on, come on, come on, come on, come on. Yes, 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 yes. Yes! Yes! Yeah! Oh! No! No! Oh!
David, are you okay?
I don't know.
What's
I
wrong?
don't know. I don't know. I'm just having some chest pains in my eyes. Everything's blurry.
You're lucky I have my clinical bag here.
Yeah. I feel really nauseated.
Have you been taking your hypertension medications?
No. I don't need it.
How long have you not been taking them?
I don't know. It was like a couple months when I went to the doctor. I don't know. Oh, shoot. Oh my gosh.
Let me get your blood pressure really quick.
Okay. Good Lord. Oh. Oh.
Oh my goodness, your blood pressure is really high.
I think I'm bleeding from my nose.
Okay, well let me go get the car started. We're gonna go to the hospital right away, okay?
Come in. Hey, Doc.
Hey, doctor. Hello, Mr. David. You have been brought to the hospital today because you have something called hypertensive crisis. Your labs and x-rays have been sent and I will evaluate them when they are ready.
Hypertensive crisis happens when blood pressure is greater than 180/120. It is split into two categories, hypertensive emergency and hypertensive urgency.
How long have you been dealing with hypertension?
Oh, well, I was at the doctor's office a few months ago, and he told me to keep an eye on my hypertension.
Were you prescribed any medications to control your blood pressure?
Yeah, he did prescribe me something. He did prescribe me a anti-hypertension medication. I forgot what the name is, but I haven't been taking it for a few months because these past few months I felt fine, you know. I felt like I was healthy, you know, but I guess I was wrong.
Alright, well, it is important to take your medication so this doesn't happen again. And so that having more serious health problems such as heart attacks and strokes don't happen. In this case, you have hypertensive urgency, which means that your organs have not been affected, but your blood pressure needs to be controlled before the pressure affects any other parts of your body and any vital organs. These oral meds should help decrease your blood pressure.
If it were an emergency, the patient would get IV infusions of vasodilators such as nitropres, cardine, carlopam, enalapril, and nitroglycerin. But in a hypertensive urgency situation such as this, the patient is receiving PO meds such as beta-adrenergic blocking agents such as Trandate, ACE inhibitors, or alpha-2 agonists. It is important to gradually decrease the blood pressure.
For now, we're just going to monitor your blood pressure every 5 minutes. Okay? So I'm going to get your blood pressure really fast.
Awesome.
Okay. Well, your blood pressure is pretty high still, but we're going to keep monitoring it every 15 to 30 minutes until it stabilizes again, okay?
All right, thanks, Doc. You know, I don't want to have a heart attack or, you know, anything serious. You know, so I'll continue my medication that I should have done in the beginning.
Okay.
Thanks, Doc.
In review, those who are affected by hypertensive crisis are those who have poorly controlled hypertension, those who have undiagnosed hypertension, and those who abruptly discontinue their hypertension medications. Signs and symptoms of those whom you may suspect to have hypertensive crisis include chest pains, headaches, confusion, blurred vision, nosebleeds, nausea and vomiting, and also anxiety. And in severe cases, you'll see unresponsiveness, seizures, heart failure, and kidney failure. And what you should do right away when you see that or think that somebody has hypertensive crisis would be to reassess their blood pressure in case you see that it is above 180/120. You'd call 911 right away, and you'd get the person to the hospital in a safe, calm, and quick way. And remember that hypertensive emergency involves organ damage. And IV meds are used in emergency situations, whereas oral meds are used in urgent situations. And different methods to lower blood pressure in emergency and urgent hypertensions include this. In hypertensive emergency, the blood pressure must be lowered immediately to halt or prevent damage to the target organs, and the person may need to be treated in an intensive care unit. The therapeutic goal is to lower the blood pressure by up to 25% within the first hour of treatment. The goal is for hypertensive urgency is to lower the blood pressure within 24 to 48 hours. It's important not to abruptly lower the blood pressure due to rapid reduction in blood pressure below the cerebral, renal, and/or coronary autoregulatory range. This will result in a marked reduction in organ blood flow, leading to ischemia and infarction. Vital signs are taken every 5 minutes if the blood pressure is changing rapidly. Otherwise, taking the vital signs 15 to 30-minute intervals in a more stable situation may be sufficient. And an intra-arterial blood pressure monitoring may be required in patients with blood pressures that is difficult to control.